Do health and wellness programs work? What is the connection between health and productivity? Is there a way to objectively demonstrate the answer to these and other related questions? Welcome to the latest episode of the Catalyst Health, Wellness, and Performance Coaching Podcast. I'm your host, Dr. Bradford Cooper of the Catalyst Coaching Institute, and today's guest is Dr. Ron Goetzel, Senior Scientist and Director of the Institute for Health and Productivity Studies at the Hopkins Bloomberg School of Public Health. Dr. Goetzel is internationally recognized for leading innovative, cutting-edge research focused on the relationship between health and well-being, medical costs, and work-related productivity. Now, as we focus in on the data behind health, wellness, and productivity today, you may be wondering about the role of health and wellness coaching for your employee team members, or perhaps you're considering going that route with your own career. We're happy to connect to discuss either one of these, along with the role of the National Board Certification process through the MBHWC and why that matters so much to both employers and individuals. Reach out to us anytime to set up a time to discuss. Results at catalystcoachinginstitute.com. Now, let's turn up that productivity meter as we dig into the practical aspects of the research with Dr. Ron Goetzel on the latest episode of the Catalyst Health, Wellness, and Performance Coaching Podcast. Dr. Ron Goetzel, such a privilege. I've known you for many years. We've crossed paths multiple times. I can remember the dinner we had with Michael and all kinds of people that we've actually, frankly, had, I think, three of others from that dinner on the podcast. So that was quite the evening, and it's good to see you.
Good to be on this podcast with you. Glad to be part of this enlightenment, Brad, that you are offering to your listeners.
Well, and I'm so happy to have you here today because the evidence-based approach is central to what we're doing here. We're so tired of the whole headlines and fads and all that kind of stuff. And your entire career has been about pushing that stuff to the side. So this should be fantastic. So right out of the gate, the term healthcare gets all the attention in the news and the government agencies, but you've shared that it's the prevention piece that's really at the core of the issue. There's a softball lob to you. Take that where you'd like to go with it and fill us in.
Right. I think certainly it's obvious to your listeners that there's a difference between health and health care. So if you think about it very simply, health care is what you get when you get sick. So if I'm perfectly happy, if I'm going about my day-to-day business, I'm not disabled, I'm happy, I don't need health care. I just need to be healthy. And the problem in this country, mostly, is that we spend a lot of time and attention and money on health care. So if you think about the amount of dollars that are spent each year on health care, roughly $3.5 trillion and rising, at a good clip on a regular basis. Less than 5% of that, probably closer to 3%, is spent on prevention and health promotion, which is what we're all about. And the rest is spent on diseases and disorders that many of which could be prevented in the first place. And that's getting worse by the day. Yeah. So there really is a difference between health and health care. And unfortunately, when we talk about health care in the national debates and politics and all that stuff, we're really talking about how to move money around and how to get it into the right pocket and who's going to make a profit over people being sick.
Right. Yeah, nice way to set that up. All right, much of your work bridges the gap between the business world and academia. Now, my friend, that is quite the bridge. What have you learned in the process? What gives you the hope of it improving in the years ahead?
Well, I think they're two different communities and they come from different places. Yes. So the business world are people who are basically go-getters. They want to start a business. They want to be creative. They want to be entrepreneurial. Bottom line, they want to make money in the process. Academia, on the other hand, are people who want to study the world and they want to come up with creative ideas and they want to empirically test hypotheses and they want to gain as much knowledge as possible. But they are often a bit less concerned about the practical application of all of that. So wouldn't it be wonderful if you took, people who want to make things happen like tomorrow, business people, and the people who are thoughtful about what that might mean and how to get there, and bring them together and have conversations. So one little tidbit that I like to talk about is In academia, what's important in terms of proving something is a 0.05 level of confidence. And what that means is that there's a 95% chance that what you're finding is actually true. In business, it's probably closer to 0.50 level of confidence. In other words, oftentimes decisions are made by flipping a coin. Should I go this way? Should I go that way? What does my gut feel? So the idea is to bring those two worlds together so that decisions are made more in terms of actual evidence as opposed to just gut.
And I have not spent the time you have, but as I went through my PhD, obviously was coming from the business world, had some fascinating conversations. My professors were incredibly supportive. It is two completely different worlds. How do you create that connection? How do you help? Because it goes both directions. The people in the business world are saying, yeah, those academicians, they don't know what they're doing. And then the academics are saying, yeah, those business people, they're idiots, whatever. Have you found some ways to bring them together to have those conversations and actually listen, or just throw their stuff out like we're doing with everything else in politics and vaccines and everything else right now?
No, I think you have thoughtful business leaders, and there are plenty of them. Obviously, we need to have them in order for our economy to survive and thrive. Who do ask for data and who do ask for evidence. In fact, many of their business decisions are made based upon data. Is it going to sell better here or there? Is this design better than that design? And they test those ideas out. So there is an openness to evidence and to science and to research. I think the challenge is to take something that's done in a laboratory, let's say, and scale it up so that it has population impact. And a lot of the research nowadays is actually moving beyond the laboratory and moving into the real world, practical world. So the world we inhabit right now is the world of corporate health management, health and well-being, health promotion, wellness, whatever you want to call it. But that's a very real practical world. I've got an employee population of 1,000 people. I want to make them happier and healthier. Now, how do I do that? You're the expert. You've studied it. I don't have the time to do it. Tell me how to do that.
Right. All right. It's good to hear they're out there. It's a tough one. You've discussed the fact that behavior change is incredibly difficult for us all. Obviously, not news to anybody listening to this, which makes generic wellness programs of very little value because they don't have the fuel to swim upstream against that difficulty. If you had a magic wand, Ron, and full support of the executive team, what would be some of the most important elements you'd build into a health and wellness program that actually could get legs, could create traction?
So I think you can think about health and well-being programs as having different horizons. So there's like a horizon of immediately, what can you do? And immediately is 6 to 12 months, let's say. There's kind of a medium term of, maybe 1 to 5 years. And then there's a very long term. So kind of immediately, we'll take a current example right now with COVID-19, immediately get people vaccinated, immediately get them tested, immediately get them isolated if they have the disease, do contact tracing, do those kinds of things, because that's going to save lives. It's going to improve people's health and so forth. That's a very practical kind of like, let's get this done tomorrow.
Right.
And I think the business community obviously has a huge amount of influence, especially over its own workforce. And we've seen evidence of that over the past several months, that you can, as a business, mandate things. And do it in an ethical way. In the longer term, so let's say you have a workforce and you want to improve the quality of the work outcome and performance and productivity, there are certain things that you can do to improve people's healthy behaviors and healthy lifestyles. So get them to exercise, to be physically active, not necessarily exercise, be physically active, get them to eat healthier, get them to quit smoking, get them to manage their stress better, have work-life balance, control their blood pressure, cholesterol, glucose, those factors. And if you can move the needle even slightly, even if you get, 1% or 2% of the population to actually all of a sudden change a lifelong behavior, that's going to make a big difference. Actually, that will improve your bottom line, because those people are going to cost you less money. They're going to be less absent at work. They're going to be more present at work, lower disability costs, and so forth. So that's kind of the medium term. And then the longer term is much more complicated, because that talks about influencing the norms of society. So, when I was a kid, we had a lot of cereal commercials that were basically candy. So eat this. I even grew up at a time when, doctors were on the air recommending smoking. And the list goes on and on about societal factors. And so over the past several decades, there have been structural changes in our society, many of which have led to poor health outcomes. So the way to influence that is to somehow influence policy. And by policy, I mean, people at the local level, at the county level, or the city, county, town level, state level, and eventually the federal level, where they can put in place programs and policies and legislation that can affect population health. And that's a much longer term road trip that you have to go on, but in the long run probably has a greater effect.
All right, so a couple of follow-ups on that. Well, first one, just based on what you just said, how can the average person listening to this and they say, okay, yeah, that makes total sense, the long-term thing, but I work full-time, I've got kids, I maybe have an hour a week tops that I could devote to something like that. Is there someplace that we could start for those of us that aren't going to run for mayor, aren't going to be on the student council, et cetera, to help with that long-term piece?
Yeah, I mean, first of all, and my son reminds me of this, that everybody, you and I and everybody else, we all have 24 hours a day. And none of us has 24 and a half or 23,
Wait a minute.
So it's not a matter of having time or not time. Everybody's got the same time. It's how you work that time. Now, certainly some people have more flexibility in that time. I can have this conversation with you, whereas if I was sitting on an assembly plant and had to put together a car, I probably couldn't walk away for an hour and have a conversation with somebody. But we can work into our daily schedule, our daily life routines and habits that are promoting better health. Probably the easiest thing to do, assuming you allow yourself time, is just to take a walk, be physically active, get out. Now, I try to do this fairly religiously on a certain schedule, and it's certainly the walking and getting outside and bathing in the forest and doing all those things are great. But I also like to listen to the radio. I like to listen to podcasts. I like to listen to news. I like to listen to music, and have conversations if that's what I'm inclined to do. So I can find time each day to be physically active. Now, eating right, again, that's a routine and a habit. I've got my kind of go-to meals I can prepare, and I rarely, go crazy. But if I do go crazy, it's a decision that I make. There are some bad habits that I've never adopted, like starting to smoke and take illicit drugs and those kinds of things. So basically, you can take any of these risk factors, coupled with basically doing what you're supposed to be doing from a medical standpoint, which is visiting the doctor on a routine basis, getting your vital signs checked, taking medication if you need the medication, following advice. And so if you do all those things in combination, they will move you towards a healthier and happier lifestyle.
So absolutely. And everyone listening to this is like nodding their heads going, yeah, I can do that, or I'm doing that. What about on the policy side? Is there something that if I'd like to help with that in some way, but I'm not going to, again, run for mayor or whatever it might, city council. Is there something that we can do for that piece of the long term that's not for me, not looking internally, but more to help my community, to help my state, my city, my town, et cetera?
Well, some people are really into it and really dedicated, and they become very much engaged in those kinds of activities at the community level, state level, and federal level. I mean, I was just this last weekend on the Women's March in Washington, and I feel great doing it. I love being with other people who are like-minded. with me. It turns out that writing letters to your representative, even though it sounds pretty lame, actually they do count letters and they do look at the opinions. They do, yeah. They care about how many people like one thing or another, phone calls, and writing letters to the newspaper, or if you have somebody in your family who's politically engaged, talking to that person and seeing what they can get done. In today's world, it is really, really tough to get things done from a political standpoint because of just what we're going through, and we won't get into that stuff. But at the local level, at the school board, at the city council, or state legislature, sometimes if you really are interested in getting that done, you can make it happen. Now, what I do is I write research studies, I write policy papers, I get involved with foundations and other entities so that my voice is amplified and the work that I do is amplified, and then potentially it might get picked up. So a policy paper we may have written 10 years ago, all of a sudden, here it comes as something in real life that the CDC wants to do, or NIOSH wants to do, or NIH wants to do. And so that's a way of having a larger impact. But, people are not like me. They're not academic researchers or policymakers, but they may have some connection to somebody who might be interested in hearing their opinion.
Okay. Good. The other thing you mentioned that I was just like, oh my gosh, I can't let that go. You said with these different changes, even if the employer only sees a 1% to 2% engagement in actually making those changes, that provides, and you didn't say an ROI, but I felt like you were saying that gives you a positive ROI. Can you talk us through that? Because most people are like, wait, did he say 1% to 2% matters?
Yeah, and actually we have published on this issue. We've done a series of ROI modeling studies. We did them with Dow Chemical and Motorola and Union Pacific and some other companies, where we did model out and project what the savings might be, both direct savings from healthcare and productivity savings, if you were able to shift population health profile 1, 2, 3 percentage points. Now, what that means is not just engagement per se, because engagement is, I'm showing up.
Right.
But actual behavior change. So if you can get more people to exercise, if you get more people to not be obese, if you get more people to lower their blood pressure or cholesterol or glucose levels, even small 1 percentage point, 2 percentage point shifts in population health can actually generate huge savings. And we've even shown that compared to what the investment is, you can actually generate a 1-to-1 ROI or a higher than 1-to-1 ROI.
Wow, that's an eye opener. All right, so one of the pushbacks people may hear about the value of wellness to society as a whole, that is, if people are healthier, they just live longer, and then they cost the government more money in the form of Medicare and other insurance coverages. But you've noticed that's false. It does not increase the cost of Medicare. Can you walk us through that? Help us understand the other side, the reality of that argument.
Yeah, I mean, we did quite a bit of work about a decade ago for CMS, which is Centers for Medicare and Medicaid Services, Medicare, Medicaid. And one of the projects we did was called Senior Risk Reduction Demonstration, where we actually conducted a randomized trial that recruited Medicare beneficiaries from around the country. And we put them into treatment versus control groups. And the treatment groups got health promotion interventions, and they were not 1-to-1 at a doctor's level, but actually done through mailings and health assessments and educational information and coaching and things like that. And we found that there were significant improvements in the risk profile of the population that was in the intervention group compared to the control groups. And the ones that got, more intensive interventions actually did better on many of the measures, but it was basically cost neutral. It didn't cost the government any more to have those interventions, even though they improved population health. There are studies that have been published by others that indeed show that people probably live longer if they lead healthier lifestyles, but they don't necessarily cost that much more money. Now, Social Security, sure, because they're paying out more in Social Security. But Social Security is one of those programs that actually can be tweaked in such a way that you actually do come out cost neutral. And the people who lose out are the people who die early, and the people who win out are the people who live beyond what would be expected in terms of their longevity. But Medicare and Medicaid, which is very, very expensive for this country, you actually, if you lead a very healthy lifestyle, in fact, if you enter Medicare and Medicaid healthy to begin with, you're going to cost less money and you're going to live longer in the long run. So what most people don't know is that if you reach the age of 65 or 70 per se, it turns out that you are going to live a pretty long life. It's the younger people who are dying earlier. And so just maintaining a healthy life and a good quality of life is important. Also, there's this theory, and then there's actually a lot of data to support it, called the compression of morbidity. And what that means is that people's lifespan probably is around 100 years at most. I mean, there are many more people living over 100, but by and large, most people are going to be dead by the time they reach 100. However, the period of time that you're disabled, that you're sick, that you're really not having good quality of life can be compressed if you lead a healthy lifestyle. And there's a lot of evidence to show. And
that's what leads to the equal or less cost, because I still am going to have some issues at the end that I'm going to have Medicare and Medicaid paid for, but it's compressed down. Instead of spreading it out over 10 years, 5 years, maybe it's compressed into 18 months. Interesting. That's really
exactly right. So there's some people who just die in their sleep, and I'd love to be in that category.
Sure.
And just go to sleep one night and wake up the following morning. That'd be great. But
just not
there
soon.
are people who obviously do get sick. They go in nursing homes and sleep.
Right.
And unfortunately, some of them they have chronic health conditions that make it worse for them as they get older.
Interesting. All right. Improving health and wellness necessitates a partnership with evidence-based, our whole focus here, scientific research and outcomes. Yet, it seems like the most common approach to treat evidence as a democracy and tap into whoever's the most charismatic voice out there, or video, or whatever it might be. What steps can the listeners who really are committed to evidence instead of headlines and fads take to dial this in? So if someone's listening to this and they're saying, I really like what Dr. Goetzel's saying, this is super interesting, but how do I distinguish between the charismatic, whoever wrote a blog, did a video, and the real evidence, the meaningful research? How can the layperson understand the difference and dig through just all the noise that's around that right now, especially right now?
Right. I think that's the issue we're grappling with right now. But first answer to that question would be, look at the source. Where's it coming from? Is it Facebook, or is it the CDC? Is it Johns Hopkins? Is it Harvard? Or is it your grandmother? So I do a lot of evidence reviews. There's actually a process by which you do an evidence review and literature review. And there are organizations out there like the Community Guide, the Guide to Preventive Services at the CDC, as well as the U.S. Preventive Services Task Force. They do extensive research and literature, look at the best studies out there, and then come to a conclusion of, do we recommend this or do we not recommend this? Compare that to somebody going on YouTube and saying, I heard that somebody's brother's nephew's uncle's cousin, had a rash when they took a pill or had a drug or had a vaccine. And, what logic would tell you that is more credible than what a federal agency that's accountable to the people would be telling you? So I understand, the lure of conspiracy theories, and I understand, how that's, this is something I know that you don't know, and therefore I have an advantage. But the reality is, in the long run, you're not going to win. People who believe in these crazy, outlandish theories, as we're witnessing right now, they're dying, and the people who are following the science are still living.
So let's talk about the CDC accountability a little bit. One of the common things you'll hear from these folks that are following I won't say what I really think, is, well, you can't trust the CDC because that's a government thing, or that's run by the Democrats or the Republicans or whatever. Talk us through the CDC. How is that set up? What does that look like? How is that accountability built in, et cetera? I think it'd be really helpful for people to understand that, and you're right in the midst of it.
Yeah, well, CDC obviously is a federal agency that falls under the umbrella of Health and Human Services, and it's been around for many, many years. It is the backbone of our public health system in this country. Its job is to do surveillance, look at what's out there, identify problems before they get out of hand, to communicate information that's credible information, and to monitor and support local entities, especially states, in implementing public health policy that is evidence-based. So one of the issues with the CDC and why it has been seen as not as credible as you might expect is it did fall under political influence in the last administration. And, I won't go into the details, but there are stories out there where political people tried to influence what the CDC was saying and publishing and reporting or withholding. And so that led to a reduction in the level of trust that people had in the CDC. And also kind of this false claim that they kept changing their mind. And, certainly in some cases that was the case. It may have been political reasons. It may have been all kinds of other reasons. But at the end of the day, you still need a credible organization with scientists, people you can trust to give you guidance, especially as the science is very quickly changing. Where something we knew a month ago is different than what we know right now. In fact, it's almost literally changing day by day. So you can't say, well, we know this was true back in March of 2020, therefore it must be true today. That's not the way science works. At some point in our history, we thought the Earth was flat. We have all kinds of things that science has shown not to be the case. And that's because we keep exploring, we keep studying, we keep conducting empirical research. And there is no way of saying today we know everything we need to know. Let's stop here.
Let's expand on that just a little bit, because I'm not sure everyone understands that scientists are not, I'm sure some are, but as a general rule, true scientists are not trying to ever prove themselves right. The whole goal of science is to prove yourself wrong. It's to figure out, where is my gap? What did I miss? Can you expand on that a little bit and help the listeners understand, if a scientist finds X, their next goal is to show why they were wrong in many cases?
Right. I mean, the basic principle of scientific method and empirical research is to show that the null hypothesis is wrong. And what that means is a null hypothesis means there is no connection between X and Y, or Y and Z. And the way you do studies is you basically have a question, does this cause that? And the hypothesis is that, yes, it does. This causes that, but the null hypothesis is no, there is no connection. So when you conduct an experiment, you basically have to prove beyond a certain level of probability, 95 percentile or even 99 percentile, that there is this relationship. And if you don't find that, basically you say, well, we don't know the answer, we don't know, let's keep studying this. And it turns out that, sometimes things that you thought were right, or scientifically based, or common knowledge, turn out to be not the case, which is why we keep having to study things. We can't rest on our laurels and say, well, we now know exactly what causes human behavior and what causes people to be healthy and what causes people to be sick and how workplace programs work and they don't work. What we do is keep accumulating the evidence, and after a while, there's some common ideas that, until somebody disproves them, they basically guide our decisions.
Right. That's helpful. Thank you. All right. So as you peer into your crystal ball, what do you see happening in the world of health and wellness over the next, let's say, decade that might surprise our listeners? So not the typical, oh yeah, we think we're going to see this, this, and this. What do you see coming around the bend? What's maybe a surprise to folks that they think, oh, I didn't think about that possibility? That's
a really tough question, and if I knew the answer, that'd be great. I think there's a huge amount of dependence upon the technology side of medicine. And again, it's how do we deal with diabetes? How do we deal with cancer? How do we deal with mental health problems? And less of attention paid to kind of the society in which we find ourselves. So Brian Castrucci, who's the president and CEO of the Beaumont Foundation, which we work with, likens it to goldfish in a fish tank, and you can get the best fish food for that goldfish, and provide all kinds of medicines the goldfish needs. But if the water in the tank is dirty and getting dirtier, that goldfish isn't going to survive very long. So instead of just focusing on the individual and saying, we're going to get you a better treatment, a better cure, better this and that, let's look at the environment in which we find ourselves. And that environment in many places is quite toxic. Even if you think about environmental damage, the air that we breathe, the water that we drink, just the pollution in the air, to violence and trust that we don't have with one another, and access to good health care, just basic good health care. So there are some environmental factors, and we like to call them social determinants of health, which is kind of stepping back from the immediate treatment that I need in a hospital or by a doctor to my neighborhood, my community that needs care, needs attention. And that also, by the way, trickles down to the organization. My organization may be sick. They're asking me to work 12 hours a day, 7 days a week. They're yelling at me all the time. They're not providing compensation. I can't take time off for, visiting a doctor. Those things are going to be enormous contributors to my health and well-being and the health and well-being of my community. So I think there'll be more of a movement towards looking at the bigger picture instead of just focusing these trillions of dollars on healthcare on me when I'm sick. Let's spend some of that money looking at the health and well-being of a community.
So about, 35-40% of our listeners are either health and wellness coaches or they're thinking about making that a part of their future. Any tips for that person? I'm intrigued by what you just talked about, and I think it's immense. And I don't know that we touch on that or address that a lot as coaches. Can you think of a way that maybe we can dip our toe in the water on that element or those elements?
Yeah, no, I think you're asking a great question because coaches, I'm your one-to-one coach, and I'm going to help you exercise and eat healthy and smoking and do all those things, which are all absolutely necessary and important on a personal level. But then how do you do things on a more group level? And I think social media, especially for young people, they have figured out ways of getting people together towards common goals and common purposes. And they're also, and I think this is a great development, they're much more focused on purpose and mission. Kind of what is my purpose in life? What's my mission in life? What am I trying to accomplish beyond me, beyond just making myself look better, feel better, and so if you can tap into that kind of the social network connectedness need, and I believe that is not done electronically. I think it has to be done like we're doing it right now in the form of conversation and having people with you and in the same room and touching one another, hopefully at some point, that we can be engaged, not just electronically, which I think is probably not the right way to go. But if you can get groups of people working towards common purposes, and that can be building healthy communities, parks and gyms and recreational areas. It may be supporting restaurants that serve healthy food choices. It may be getting together for sports teams or social events, and building community that way, so that you feel connected to your fellow person in town, and you do gain from that, and the community gains from that.
Incredibly well said. Well, we talk about the four cornerstones of health and wellness being move, fuel, rest, and connect. And yet we don't talk about the connect piece enough, at least within our organization. That's something I need to do a better job with. But what you've just talked about there is really wrapped around that connect piece. So Love that. Love that. How about the life of Ron Goetzel? What adjustments have you made in your own life as a result of the research you've been involved with, the work that you've been involved with? Any personal stories you can share with us there that people might go, oh, that's kind of cool?
Well, I've been involved in the corporate world since the early 1980s, but even before that, my intent in life was to be a change agent, kind of a community organizer.
A catalyst.
A catalyst in the community to try to, instill change in that community. And I grew up in New York where there was lots of opportunity to do all that kind of stuff. But I learned early on that doing it one-to-one is good, but it's not as efficient as trying to do it on a more mass basis. And my direction was research. If you can gather the data and convince people that it's valid data and useful data and interpret the data so that they understand it, that's probably going to move more needles than you trying to do it one at a time. But when I was in my youth, I had a lot of very bad habits, not as many as you might think, but, I was not the right weight. I didn't eat right. I didn't floss my teeth. I didn't exercise enough and things like that. And then, when I started getting into the business of health promotion, because I hung out with people who were healthier and people who knew stuff and people who were quite smart, obviously it made sense. I was a logical person and I said, okay, let me do this. And it's just a matter of developing habits. And if you develop routines and habits, then after a while it seems routine. So, for example, you might be interested in sports and you might be an athlete. If I were to tell you, you can't train, you can't exercise, you can't practice, you can't do the things that you normally do, that would seem really crazy to you because that's not who you are, right? I mean, these are part of your life. So the same can be done for people who are not that and say, well, you should exercise, you should eat healthy, then they will say, well, that seems hard, but let me see if I can move into that sphere and be that person. And I think, basically, I try to follow my own advice. And my kids kid me, and they say, Dad, is there anything that you don't do that you advise other people to do? And I say, well, I try not to. And,
Ooh, those doggone kids, they ask those hard questions.
Well, and I've gotten them all to be really, really healthy and concerned about their health and well-being, which is great because kids do follow by example.
Yep, no doubt, no doubt. Last question, just wide open. Final words of wisdom. You're talking to folks that care about their health and wellness, their performance. They want their lives to be better. Some are coaches, but some are just they're just looking for the idea of better than yesterday. From your perspective, can be related to your research or not. Any final words of wisdom you'd like to leave us with?
I would say do it at your own pace. I mean, changes in lifestyle are really, really hard, especially as you get older. You kind of get embedded in the way you've done it before. So look for small ways to improve your health and well-being. And, they can be, I'm going to, spend 5 minutes lifting, light weights today, and that's all I'm going to do.
Yeah.
Okay, that's fine. But as long as there's a sense of satisfaction that you don't feel that you're being forced to do something, that you're doing it just to please others, and that you basically are pretty leisurely about these kinds of things, the better you'll feel. Because, in the end of the day, you'll feel better and you'll feel more energized and healthier and happier. So that's its own reward.
Yeah, love that. We had Dr. Wendy Woods and Dr. BJ Fogg on recently, and both of them right down that same alley of the tiny habits, the part of who you are, build it in gradually. It's critical. So great advice. Dr. Goetzel, thank you so much. This is great. I know your schedule is insane, and I appreciate you carving out this time for us.
Well, thank you, Brad, for inviting me. This has been really delightful. Thank you.
A big thanks to Dr. Ron Goetzel. As you heard me mention, he and I have met on multiple occasions through our work in health and wellness. And interestingly, he is the third guest to join us from a very special dinner with about a dozen industry leaders that took place a few years back. Yes, it was quite the dinner. Thanks for tuning into the #1 podcast for health and wellness coaching. We're here if you have any questions about health and wellness coaching on either a personal or organizational level. Feel free to drop us a line anytime. Email is results@catalystcoachinginstitute.com, or there are plenty of additional resources on the website, catalystcoachinginstitute.com. Next week's guest is Dr. Orb Austin, and he'll be discussing a topic that likely hits home for many of us. At least it does for me. That topic is imposter syndrome, an area that continues to garner more and more attention in this world of public transparency. Folks, now it's time to be a catalyst. The chance to make a positive difference in the world while simultaneously improving our own lives. The essence of being a catalyst. This is Dr. Bradford Cooper of the Catalyst Coaching Institute. Make it a great rest of your week, and I'll speak with you soon on the next episode of the Catalyst Health, Wellness, and Performance Coaching Podcast, or maybe over on the YouTube coaching channel.